few patients. Here we go. Hello everyone, it's Thursday, January 6th. The new year, 2022. It's hard to imagine it, really. But it's even harder, for people to imagine, that especially these families that have lost loved ones. We've lost another 31 West Virginians. I'm going to go through them right now, but I ask so much for your prayers for these great, great, great people that we've lost and all their loved ones. So please join me in that, because that is so, so important. The 5,362nd death is a 67-year-old male from Monongahelia County. The 5,363rd death, a 54-year-old female from Tyler County. The 5,364th death, a 47-year-old male from Mason County. The 5,365th death, an 83-year-old male from Doddridge County. The 5,366th death, a 51-year-old male from Kanawha County. The 5,367th death, an 86-year-old male from Cabell County. The 5,368th death, a 58-year-old male from Mason County. The 5,369th death, a 63-year-old male from Nicholas County. The 5,370th death, a 61-year-old male from Hampshire County. The 5,371st death, a 47-year-old female from Doddridge County. The 5,372nd death, a 54-year-old male from Pocahontas County. The 5,373rd death, a 66-year-old male from Morgan County. The 5,374th death, a 69-year-old male from Greenbrier County. The 5,375th death, an 82-year-old male from Mason County. The 5,376th death, a 78-year-old female from Logan County. The 5,377th death, a 76-year-old male from Summers County. The 5,378th death, a 73-year-old female from Berkeley County. The 5,379th death, an 83-year-old male from Berkeley County. The 5,380th death, a 51-year-old female from Braxton County. The 5,381st death, a 73-year-old female from Raleigh County. The 5,382nd death, a 64-year-old female from Grant County. The 5,383rd death, a 79-year-old male from Raleigh County. The 5,384th death, an 89-year-old female from Raleigh County. The 5,385th death, a 55-year-old female from Roane County. The 5,386th death, a 64-year-old female from Grant County. The 5,387th death, a 77-year-old female from Lincoln County. The 5,388th death, a 92-year-old male from Kanawha County. The 5,389th death, a 58-year-old male from Raleigh County. The 5,390th death, a 79-year-old female from Harrison County. The 5,391st death, a 49-year-old male from Wyoming County. The 5,392nd death, an 89-year-old male from Greenbrier County. 5,392 great West Virginians we've lost. It's terrible. It's just terrible. We have active cases of 11,793. We've had a big, big, big drop in that, and I think Dr. Marsh or Dr. Amjad or General Hoyer is going to tell you, that big drop is directly attributable to the fact that the CDC went to a 5-day window, and so we're now removing active cases on a 5-day basis, and that's why you saw that big drop. The daily positivity rate is at 17.36. We had 4,947 new cases in the last 24 hours. Our cumulative is at 6.74. Recovered cases a little over 330,000. There's now 758 people that are hospitalized in West Virginia, 201 on the ICU units and 115 that are on ventilators. In the state of West Virginia, we've got 5 green counties and mostly red. Our Omicron numbers continue to rise, and Dr. Marsh will tell you more about that. Our school numbers, 15 school outbreaks in 11 counties with 131 confirmed cases. That seems to be getting a little better, and that's probably attributable to the fact that we're getting more and more and more kids vaccinated. I remind people over and over and over about the fact, like I've said many times, if you get any symptoms whatsoever and you're 65 years of age and older, you've got to go get tested. These antibodies are here. You know, they're in short supply, but they are here and they are available, and we can save your life if we catch this thing early enough. You know, I encourage people about wearing a face mask. You know, if you're 65 or 50 and older or whatever it may be, and you're going into a crowd of people that you don't know indoors and everything, and we've got a big snowstorm coming right now, and so we're going to be indoors and everything. If you don't know the people or not around them and everything, and you've got any kind of compromising situation, you really should be wearing a mask. The FDA booster update, the FDA and CDC authorized Pfizer, you know, the Pfizer booster to reduce the age to 12, you know, so we've dropped from 18, I guess from 18 or 15?
From 16 now, we've dropped down to 12.
We dropped from 16 down to 12, so you know, anyone now 12 and older that are 4 months out, you know, really, rather 6 months out, need to get your booster shot. Is that correct? 5 months out, I'm sorry, 5 months out, need to get your booster shot. They've changed that too, have they not? They've changed from 6 to 5. Okay, all right, from the standpoint of our encouragement in regard to the booster, you know, situation, you'll hear more about that in just 1 second, but there can't be anything, in my opinion, more important right now than getting your booster shot. That's all there is to it. We want to get you vaccinated, especially the kids and everything. We want to get you vaccinated and everything, but at the same time, we've got so many people of our elderly people that have not taken their booster shot, and it is a big time mistake. That's all there is to it. We need to get you to take that booster shot and take it right now. Okay. Israel has been the leader along all the way. You'll hear so much more in detail in just a few minutes from Dr. Marsh about this and everything, but Israel has been the leader. You know, so many people around me, the great experts of General Hoyer and Dr. Marsh and Dr. Amjad and, you know, Secretary Crouch and all those that we call upon that are really giving us wonderful advice. You know, the Biden administration just the other day said, you know, I hate to say this like this because it sounds terrible, but evidently we've lost control of this. And so many recommendations that have come down from D.C. have been just absolutely a dog's mess. That's all there is to it. And so maybe the states really ought to handle this and everything. But if that be the case, what we're going to do right now is we're going to try to move forward, you know, hand in hand with what Israel's doing. Israel is offering the 4th dose, and they're doing that right now to people that are, and I guess that people that are 4 months out from their Pfizer or Moderna, booster shot. And so they're offering these, I guess they're offering them to a bigger population than what we would do in the beginning. But what we would do in the beginning as West Virginia, coming right out of the gate, is we would offer that 4th dose to folks 50 years of age and older, or anyone that is compromised, and in addition to that, the essential workers that we have. All the people that are out there that we called essential workers before, whether they be first responders or they be people at the grocery stores or they be people all in our hospitals, we would say, as we move forward with this in our letter to the CDC, asking for their permission to move forward. So that letter is going out today, and that is requesting from the state of West Virginia and me that we absolutely be able to move forward in giving the 4th dose to our people. The reason for this is lots of different things. First of all, it'll save a bunch more lives. That's all there is to it. But secondly, right behind that, we're going to end up with a run on our hospitals like you can't imagine. This Omicron virus is absolutely, potent from the standpoint that it is a super spreader. And absolutely, without any question, we're going to have people sitting outside the waiting room or the emergency rooms in their cars or whatever like that have had a stroke or a heart attack that can't even get into the hospital. We're going to have more and more and more of that right at our doorstep where it is right now today. Now, with all of that, we move in West Virginia. We pivot and we move. And so what we're going to do is we're going to request and make recommendation that in the state of West Virginia, those that are 50 and older that want the 4th dose, or those that are essential workers, can get that 4th dose, and they can get it right now. So that'll be going up, and you'll be hearing a whole lot more about that from Dr. Marsh and General Hoyer and everything. We had a meeting earlier today. They came down, they're joining me today, and they came down and we discussed this at length and everything. It was their recommendation, my recommendation to move forward on this, and so we're sending the letter, and we're sending the letter right now. CDC continues to offer up a lot of guidelines, and I know they're terribly confusing to lots and lots of folks. I think they pretty much settled in on this, that if you're tested positive for COVID today, you're to quarantine yourself for 5 days, and then after the 5 days, you can go back to work and everything, but at the same time you're going back to work, and they recommend you wear a mask for 5 days. But I think that's where they're settling out right now, but I'd stay tuned. General Hoyer just mentioned something to me just a few minutes ago. He said a number that he watches and watches all along. It's just this: the adult population, the people that are 18 and above in the state of West Virginia. Now, the people that are 18 and above, we have 71.6% of those folks have received their first shot. Now, that's really significant because he says he watches it trend all the time. It goes up about a 0.1% every day, which means that we're getting there. We're slowly but surely getting more and more and more of our folks vaccinated, our adult population. Now, we want to get our kids as well, but absolutely, he sees that as real progress. I've got to, again, listen to the goodness of where we are. We want to absolutely always look at this glass as half full rather than half empty. I've never seen anybody that's going to go way down the pike, in this world looking at glass as half empty. I encourage our parents and grandparents to help us with getting the kids vaccinated, and all the COVID vaccine information's up there. About the free testing, all the different stuff, that we've gone through there, and we go back to long ago, it seems like now, but Frith and Walgreens, what partners they've been, and what good stuff that they've done. Get this number, it's not good, not good. But our long-term, in our long-term care facilities, we're up to 100 outbreaks in our long-term care facilities. It's not good. We have 1 outbreak in our church community in Monroe County. We have 138 inmates and 115 staff folks that have this right now. I remind you about your flu shots. You can take your COVID shot at the same time. I remind you, if you're a renter or a landlord, call us. For crying out loud, call us. We may very well get you qualified and put some real dollars in your pocket. I remind you about giving blood. Over and over and over, I just say just this. If you especially have had the blessing of recovery from this dreaded pandemic, do you not owe yourself something there? Owe your brethren something from the standpoint of considering the possibility of you should be given blood? We ask you just to think about it. That's all there is to it. And think about it, and hopefully more and more and more people will get across the finish line there. Like I said just a minute ago, we've got a big storm coming. It's wintertime, folks. That's just all there is to it. And with all of that, we deal with it. We're going to have probably 3 to 8 inches of snow. I'll look at it as beautiful stuff. We'll deal with it. All of our emergency operations center is prepared, and they're ready to go. And at the same time, we surely know how to deal with tough things, and this surely won't be anything more than just a blip on the screen that we'll have to deal with. So nevertheless, be prepared, and it surely won't be anything terribly significant, we hope and pray. from the standpoint of tourism, more recognition that's coming to the state of West Virginia. You know, Frommer's. You know, Frommer's, you know, is one of the national travel guide publishers and everything, and they just came out and named West Virginia one of the 10 best places to go in the United States in 2021, or 2022 rather. Now just think about it. If you go back, first it was Time magazine naming West Virginia as one of the world's greatest prizes or places. Then Lonely Planet named West Virginia in the top 10 global travel destinations to visit in 2022. And then Condé Nast named West Virginia as one of the best places to go, I think one of the top 25 places in the world to go in 2022. You know, just think back. Just think back. And, you know, I can only think back as long as I've been here. But in the first State of the State address, I said to everyone, I said, we have got to some way address and change our image. We know how good we really are, but the outside world doesn't. The outside world thinks we're poor and backward and dingy and whatever it may be, not educated. You know, absolutely, they were so wrong. They were so wrong. And absolutely, as we've moved forward, all of a sudden the world has really noticed the treasure that we really are. So with all that, I just hope and pray that more and more goodness will come. We're going to give a State of the State address and everything. It's going to be on next Wednesday night at 7 o'clock. In the State of the State address, I really encourage you to tune in and to watch, because there's going to be some more major announcements at the State of the State, and just more and more goodness coming to West Virginia. So please tune in next Wednesday at 7 o'clock, and hopefully I won't botch it up, and you know, hopefully it'll be good stuff. I know we're going to report some really exciting news that's going to be happening in West Virginia. So thank you so much. That's all I've got.
All right, thank you, Governor. Let's first today go to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. So the CDC has shortened the recommendations for the isolation and quarantine guidelines. So you might see an update to our dashboard, as the governor stated. Because of the 5-day isolation period, the cases or the active cases on the dashboard have declined. So there are 11,793 today. A couple of days ago, of course, it was higher. So if you've been watching that carefully, there is a reason behind that. We are following CDC's recommendations for isolations to 5 days with all the new information that's out there. And Jordan put up on the screen, there's a red it's red ink there that you can click on to explain it even more. But if there's any further questions, we'd be happy to answer them. But that is why there's a lower number on there to follow the CDC guidelines. Thanks, Jordan.
Thank you, Dr. Amjad. Next, we'll go to Dr. Claymarsh, our coronavirus czar.
Well, good morning. The governor has really pointed out a number of very important issues that are becoming more clear every day related to the new Omicron variant of COVID-19. And as we have seen through the rest of the pandemic, West Virginia has some benefit in the spread of COVID-19 in that we, because we're a more rural state, we can see what happens in places ahead of us, including more urban states and population centers in the country. And we've seen that Omicron spreads much more rapidly than any variant that we have seen to date. The other thing that we are starting to see, which is of concern, and the governor alluded to this, but we have seen a doubling of the average number of children admitted to hospitals in the U.S. on a daily basis over the last week. In the week that ended January 2nd, there was an average of 672 children admitted to hospitals in the United States, which is a substantial increase in a week. And in many hospitals, they are seeing children who are hospitalized who are much sicker than they have seen during other parts of the pandemic. And the Indiana health system for children, they have seen a 4 times increase in the number of children hospitalized as compared to any other part of the pandemic. And they have seen 40% of those hospitalized children needing to be put on ventilators. So these children are actually very sick. And it may relate to the way that we believe Omicron infects versus the Delta variant or others. We believe Omicron might have a higher predilection for upper airways. And so children with smaller airways in general have less room to have reserve if there is inflammation and narrowing of those airways. And we believe that a kind of croup-like or bronchitis or bronchiolitis-like disease, like we can see with other viruses like respiratory syncytial virus, may be the cause of this. But this is a really important finding, and people really need to wake up and make sure that they understand now this virus is no longer, benign for anyone, but particularly not for children. And when we look at our own vaccination rates, we see that that's the lowest group that we've seen vaccinated. And as the governor said, the CDC just seconded the FDA's guidance yesterday. So now any American who's 5 months after their second dose of Pfizer or Moderna, who is 12 years old or over, can get a booster dose with Pfizer. And for the 12 to 18-year-olds, really, Pfizer is the only approved booster dose. And as we look across the world, we see that Israel, as the governor mentioned, who we believe and we look at as the world leaders in testing and pushing the envelope of how the vaccines can be used to help people live better, longer, and save lives, has found that the risk of reinfection with Omicron goes up by threefold in that 3 to 4 month window after the first booster dose. And they've decided now to give a booster dose, offer a booster dose to any Israeli who is 60 years old or over, any Israeli who is a resident of a nursing home, or anyone who has an immunocompromising disease with the 4th dose. And they found this 4th dose is very safe. People are not having any new reactions with it, and they've used Pfizer, so this is all Pfizer. And they found after a week, they're seeing a 5 times increase in the number of antibodies, which is very important to protect us from having the consequences of infection and perhaps severe complications of COVID-19. We also know that unvaccinated people are making up the absolute high majority of people in hospitals and people dying, and the risk of dying is between 10 and 30 times higher in unvaccinated versus vaccinated, and the risk of hospitalization in 12 to 17-year-olds is 10 times higher than in children that are fully vaccinated. So it's really important that we get to the vaccinations. In West Virginia, we are starting to see our hospital numbers increase. We also are seeing that many of the staff, which were already short on, are getting infected with COVID-19, which is reducing the ability for our hospitals to process the increasingly sick numbers of people that are coming to the emergency room. And as the governor said, many hospitals now have had to go to having people wait in their cars so that hospital space can open up for them to go in. And some hospitals have started to use tents adjacent to the emergency rooms to process people. And we have not even seen the brunt of what Omicron is going to do as far as spread in West Virginia, but recognize that if you are 4 months or more after your booster dose, or you are 5 months or more after your first 2 vaccine doses, the potency of your vaccine to protect you from getting reinfected with the Omicron variant is down, and we are very worried about the increasing hospital numbers. In West Virginia, we have not seen a rise in hospital numbers in children, which is 8 today, and we are watching that very closely. But the reason why we are so focused at trying to move to a fourth dose in West Virginia is because we vaccinated our most vulnerable population first, nursing home, over 70, over 50, and we know that the lag time now is the longest for them, and we are very quickly approaching that 4-month window when we know the potency of those vaccines are wearing off, and we can't afford in West Virginia to have our most vulnerable get sick with COVID-19. We can't afford to surge at our hospital levels, and we have to also really focus at vaccinating our children, because our children are at risk from this variant of COVID-19 at a different level than we've seen before. In South Africa, they also saw a 4 times increase in hospitalizations with children than they did at any other time during the pandemic. So it's really time for us to lead West Virginia and also protect our most vulnerable and our most valuable asset, our children. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. I'll reinforce points from the governor and Dr. Marsh. Our hospital numbers today, 750 plus in the hospitals across the state with COVID. We saw a significant increase in the daily admission for COVID patients, up from 102 yesterday to 117 today. And as both the governor and Dr. Marsh pointed out, our primary concern right now is not availability of beds or equipment, it is staffing. So again, I would request all West Virginians who have not been vaccinated to consider getting vaccinated. We know that that makes up the bulk of our hospitalizations, and those who are unvaccinated are putting significant pressure on our hospital and our medical staff, as well as making the availability of others to receive the appropriate level of care that they need in other areas. As the governor pointed out, there is some good news in that we continue to see West Virginians receive the vaccine, both first dose and booster dose. The challenge becomes that it is not at the speed that we need to blunt the Omicron surge that we're getting ready to see. So again, would ask everyone to consider, if you haven't, to get vaccinated. Those who have received their vaccination, West Virginians over the age of 50 with 2 doses is 72%, but we're not near that number on the booster dose. So again, encourage everyone to move forward and get that done to help us get through this as quickly and effectively as possible. Thank you.
Thank you, sir. Secretary Bill Crouch with the DHHR had a prior engagement and will rejoin us next week. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11. Kenny, if you're speaking, you're muted.
Wasn't speaking, but now, sorry for the delay. A couple of quick questions, if I may. The first one would be, I know that we're emphasizing first shots that people are getting. The governor mentioned about 70-some%, maybe 71%. But from a layman's standpoint, shouldn't the emphasis be, and the number that we're really looking at are either fully vaccinated or preferably those who have boosters? Isn't that the true number of people that have the most protection from the virus? And someone, I know the first shot numbers are bigger, but perhaps the booster numbers are more important. And secondly, this is probably a confusing question, so I apologize in advance. But can Dr. Marsh or Dr. Amjad address the question that how many people are actually in the hospital because of COVID, and how many people are in the hospital for whatever and discover they have COVID? They had no idea they had it. Is there any way that that's been tracked, or that we know what the totals are? People who are actually in the hospital with intent because of COVID, and those who actually find out when they're admitted for some other reason. Thank you.
Kenny, let me comment just a second on the first part of your question, and I'm going to defer to Dr. Marsh, and then Dr. Amjad maybe can do the second part. But Kenny, here's the thing. General Hoyer's comment, about the 70.6% or whatever, right at 71% of the 18 and older, the adults, that are in the state, it was a comment to say just this. It is a metric that we're watching because as it continues to move up, we have to believe that we're continuing on a pathway to get people the first shot and then continue on the pathway to get them all the way through the process of getting their second shot and the booster and everything. With all of that, it's a metric, and that's all it is. From the standpoint of should we concentrate more on people, on looking at the population from the standpoint of how do we get people to get their second shot? How do we get people to get their booster shot? Over and over and over, I don't know how many times I've said it. I've said it 10,000 times. The booster shot is the shot that I cannot possibly imagine if you've gotten 2 shots, why you wouldn't go ahead and get your booster shot. Why would you take the chance if you had decided in life to get both your shots and be fully vaccinated? Why in the world, with all these experts telling you that if you're 5 months now, 5 months out from when you got your second shot, you don't have hardly any immunity. And really and true, I cannot understand how, if someone had gotten vaccinated, they wouldn't be running to get that booster shot. So you're right from the standpoint of what we want to do is get people first, second shot, and then if boosters are needed, the booster. Absolutely, you're right on that. But the metric that General Hoyer is using to see as we continue to get more and more, of the, forgive me, hell knowers to come and get their first shot, we get them on a pathway of getting them fully vaccinated. So you're right, but it's a good metric that he's using. Now I'll pass to Dr. Marsh and General Hoyer.
So thank you, Governor. Thank you, Kenny. I think the governor said it very well. We want people with as much active and current immunity as we can, particularly as we are anticipating to find the growth of Omicron in West Virginia, as we've seen in the country, and having the first and second vaccines and the people eligible to have the boosters gives us the best active immunity protection from getting infected with COVID-19, from being hospitalized from COVID-19, and from dying from COVID-19. I'm going to address briefly, and then I can pass to Dr. Amjad or General Hoyer about your question about the relationship between COVID positivity and hospital numbers. I think that it's really important for us to kind of level set the reason why we're so worried about the hospital numbers and about the spread of COVID-19. And it's because we are worried about the capacity in our hospitals. And the capacity not only to take care of people who may be infected with COVID-19, but also to take care of people who have other acute medical needs like heart attacks and strokes and car accidents and cancer and other things. And as we take up more and more of the bed capacity in our state hospitals, and as we see more and more of our staff either get sick and not be able to work to take care of people, or to get fatigued and tired and burned out and decide that they don't want to do this anymore, either way, it reduces our capacity and our reserve and our ability to respond. So whether or not a person is in a hospital bed with COVID-19 because COVID brought them there, or somebody's in a hospital bed and they test positive for COVID-19, the fact they're in that hospital bed and that they are taking up the capacity of our hospitals is very, very concerning to us. And we see the numbers starting to rise again. We reached 1,012 people on September 28th, I believe. And ultimately, we will not be able to do that again, given our current staffing needs. And we can't afford to surge the emergency rooms, and we can't afford for people to continue to get sick from this variant of COVID-19 that has not yet gone through our population. We're still behind. So we're seeing the cases go way up, but we have not even come close to the peak of what we're going to see coming up. So it is the time now for us to really prepare and to get ourselves vaccinated and boosted and protect ourselves with wearing masks and being careful for this period of time as Omicron comes to West Virginia and hopefully goes away from West Virginia. But this is a critical time for us.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask if we have a hopeful timeline for beginning to administer these fourth shots. So I know we're going to request this from the CDC. Do we know how long it'll take to hear back one way or the other? And then what sort of impact would the fourth dose have on the Omicron wave we're experiencing now? Even if we got permission today and we're start to give these shots out today, would it have any impact on what we're experiencing now? Thank you.
Dr. Marsh, please go.
Thank you, Governor, and thank you, Charles. So we know that the CDC and the FDA do have a clear process for approving for emergency use authorization any kind of biologic, including vaccines. We hope that we can get a rapid decision from FDA and CDC to look at us like Israel has been for the rest of the world, to be able to assess the impact of a fourth vaccine on a state with the most vulnerable population in the country, who vaccinated many of their most vulnerable the earliest in the pandemic response. So in Israel, we know that the risk of reinfection went up by over 3 times in people that were 3 to 4 months after their first booster. And we know that in early data from Israel, in 7 days of getting a fourth Pfizer vaccine for those 4 months after their first boost dose, they have seen an increase in antibody levels go up by 5 times, which will give us more immune protection against infection, hospitalization, and death with any form of COVID-19, including the Omicron variant.
All right, thank you, Charles. Next to David Beard with the Dominion Post.
Hi. I've been told that our county health officer here in Mon County has suggested to county leaders that businesses encourage their employees to work remotely as much as possible during this period. And I'm wondering if that's a recommendation that you would urge statewide, not any kind of mandate or business closures, but just encouraging people to work remotely for a while. Thanks.
David, I don't think we're ready to do that right yet, but at the same time, Dr. Amjad, maybe Dr. Amjad could answer that, please.
Yes, Governor. David, I agree with what the governor said. We're not at that point yet. I mean, we still have a lot of staff who do work remotely for various reasons, but I do believe that if you're following all the safe practices, you've been boosted, you're wearing a mask when appropriate, that you should be able to go to work, because we also know that a lot of people still go out to Walmart, restaurants, and things like that. So I don't think we're at that point yet. And I don't think that's going to stop anything different unless you follow all the other mitigation strategies. Thanks.
All right, thanks, David. Next to Mark Curtis with Next Star Media.
Good afternoon, Governor and cabinet members and fellow reporters. I'm curious, to your knowledge, is West Virginia the very first state to request the authorization to do the fourth shot? And if so, are there mitigating circumstances that may make our case more powerful, or might it be wise for the state of West Virginia to join together with the National Governors Association or the Republican Governors Association and go in and have a more forceful request with multiple states asking at the same time?
Well, Mark, my feeling is this, we had to make a decision at one point in time in regard to our nursing homes. And we came right out of the gate and said, instead of putting the vaccines on shelves, we're going to get them in people's arms. And we're going to go right where the problem really lies, and that's with the elderly. And so we ran there, and we ran there just right off the get-go, did we not? Now, along the way, by getting out of the gate first and everything, you know, we've kind of forgotten the most important ingredient of the whole deal, and that was save lives. And by doing that at a time when this thing was really ramped up, we saved a bunch of lives. Now, nobody can dispute that. But then all of a sudden we hit this wall to where we've got a bunch of folks that we really knew existed within West Virginia that just absolutely don't want to take the vaccine. And then there's been people that have sat back and they've said, well, what happened to West Virginia? You know, they got out in front and they were leading the way and everything, and now they've slipped back. And they want to focus on the slip back. Well, we knew the people were there. We knew the people were there that really were hesitant or didn't understand the vaccines. We knew that. We've known that all along. But absolutely, what we did in the first moves was we saved a bunch of lives. Now, in the situation we're in right now, we know without any question that there's still a lot of people out there that haven't been vaccinated at all. And we continue to preach and try to get them across the finish line. But we also know this. We also know that West Virginia is one of the oldest states in the country. And West Virginia abounds in chronic illnesses. We know that, do we not? And we know that we're surrounded not by an ocean or a Great Lake. We're surrounded by people all around us. 2/3 of the entire population of the United States is within striking distance of us all the time. We know all of that. So in all of that, what we believe and what the recommendations of these great experts are, and myself, we believe that we got to move. We got to move again. Now, we can do this, Mark, and this is not a smart aleck answer, but it's this type of answer. What is the definition of committee? We can go and get with all the other governors and we can go through all that. Well, in my opinion, just this. Definition of committee. At times, it's a collection of individuals that oftentimes can't really do anything. And oftentimes, really and truly, what they can decide as a committee is that nothing can be done. Well, I'm not a believer in that. I'm a believer that we have to act. We want to be responsible. We want to be safe. Absolutely. That's why we go through our experts. That's why we go through the CDC. But we got West Virginians out there that we know if they're right now 5 months out from their last booster, shot, or really it's even less months than that. It's 3.
It's 5 months in the U.S., but it's 4 months in Israel.
It's 4 months out from their booster shot.
From their first booster shot.
From their booster shot. If they're 4 months out from their booster shot in Israel today, and that they're exposed, we know it. We know that people that are 4 months out from their booster shot right now, their immunity has dropped way, way off. And we know that West Virginians are, have some of the most chronic illnesses, and we know that West Virginians are old. Now, with all of that, we got to do something. Either we sit back and just let our people die, and we sit back and let our hospitals be overrun, or we try. And so with that, Mark, if the CDC comes back and says, nope, we can't do this now, and then there's enough governors that go together, we'll sure go with them, and then we may get across the finish line that way. But really and truly, we really believe that we need to get that 4th booster or 4th dose. But, Doc, General, anybody got anything? Okay. That's all we got, Mark.
All right, thanks, Mark. Next to Paul Mullen with WCBC.
Good afternoon, Governor, panel, fellow media members. Governor, I want to put a bow on this puppy. You do have a higher at risk population than anyone else. And we do have a winter storm coming out there, and we do have people recovering from COVID. Could we get any words of caution from the medical staff on not overdoing it as this winter storm dumps a couple of inches of snow in the middle part or a great swath of the great state of West Virginia? Thank you.
Well, Mark, you know, and keep that picture right there just 1 second, Jordan. Mark, can you see Baby Dog right here? You know, Mark, when this winter storm drops that snow for the elderly and those that have a bunch of chronic illnesses, or maybe those that are worried or have COVID and everything, they need to leave that snow on the ground and do just what Baby Dog's doing right now. Baby Dog's just kicked back, and she's not going to worry a lot about that snow right now. And I would recommend you do the same thing, because, you know, people can get in real trouble with that as well. And the bad part about it is if you get out there shoveling snow and everything and then have a health issue and need to run to the hospital and everything, you may end up sitting in a car in the parking lot. You know, so I didn't see that picture, it just came up. But Baby Dog is, she just kicked back right now.
All right, thank you, Paul. Governor, I'll turn it back to you to close out.
Well, again, I remind everybody about the state of the state. I think we'll have some exciting things that we'll be announcing then. You know, I go back to our experts, and I go back to Dr. Marsh telling us about all across the United States, the number of children cases is doubling. Now, just think about it. It's doubling. And in one hospital, I think in Indiana, you know, of the children that are in the hospital, 40% of them are on ventilators. And I would tell all of you parents, all of you, you know, do you really, really want to run any level of risk that could be your child? I ask for prayers for all those children and everything, but please remember just how absolutely devastating this thing can be and how infectious it truly is right now. I talked to you just 1 second again about the 4th dose. We sent the letter up, or sending the letter up to request from the CDC to allow West Virginians to move forward and take the 4th dose for anyone over the age of 50 years of age or anyone that is an essential worker within our state. You know, I go back to when the decisions were made in the very beginning to move and don't leave those vaccines in the warehouses. You know, we saved a bunch of lives in doing so. We absolutely feel rock solid that these vaccines are safe. And for right now, and I tell everybody this over and over, these vaccines, I mean, let's just tell it like it bloomin' is. These vaccines are only a temporary bridge to get us to an absolute resolution of this, to where the smart people, the scientists, the medical people, somebody comes up with a way to stop it, to dead level stop it. And we hope and pray that's going to come real soon. But in the meantime, if the vaccines are a bridge to protect us for 4 months or for 6 months or whatever it may be, I mean, for crying out loud, we need to take advantage of that. So in all of that, you know, I've got an incredible team all around me, and you know, we just want to be extra safe with this little bit of snowstorm that's coming, but this isn't the you know, Senator Rockefeller all out and out blizzard, everybody run for the hills and everything. This is not that. This is just a little bit of snowstorm and a blessing at wintertime that we have these wonderful 4 seasons. So don't be crazy and don't get out and don't be driving, you know, recklessly, or don't get out shoveling snow if you've got a health condition. Just, you know, let it snow and do that for Baby Dog too. So anyway, thank y'all so much.